Hi, I'm Marty Cohn, and welcome to episode 7 of Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information on health-related topics. Grace Cottage is an independent healthcare facility located in Townsend, Vermont, just 17 miles north of Brattleboro. Among its services are primary care, rehabilitation, and 24/7 emergency care. Its mission is to promote wellness, relieve suffering, and restore health. In today's episode, we will be discussing the unique role that nurse practitioners have played in the evolution of today's healthcare system. Our guest is Louise McDevitt, a nurse practitioner at Grace Cottage Hospital. Welcome, Louise.
Well, thanks, Marty. And
thank you for coming on the show.
As you can see, all of that fits into this beautiful building there in Townsend.
It's a wonderful
It's
wonderful
not that
place.
far away. You said 17 miles,
17
like we were
miles.
going to Alaska or something.
Well, I want people to get a sense. A lot of people know Brattleboro. I want to give them a sense of you're not that far away.
This is true.
So, Louise, how long have you been a certified nurse practitioner?
I've been a certified nurse practitioner since 1989, so this is my 29th year,
Wow.
actually. And I graduated from Simmons College in Boston. And I kept going. I started out as an adult nurse practitioner, and then I was working at the Mount Snow Clinic and realized I was seeing kids under 13. And at that time, everyone would say, "Oh, don't worry, that so-and-so will back you up." And I thought that perhaps I should expand my knowledge. I did my family nurse practitioner, and then I continued on to acute care nurse practitioner. So essentially, it started out, and that's the beauty of medicine, is you get to keep going, and every day's a new day, and every day you get to learn more and more.
So you started out at Mount Snow. When did you begin practicing at Grace Cottage?
Well, that was at about 26 years ago, I'd say. Maybe 25 and a half.
Wow, that's a long time.
I know.
That's a few years.
I know. Pretty soon I'll get a paver in the parking lot with my name on it.
So let me ask you, in terms of nurse practitioner, what level of training does a nurse practitioner have?
Well, our education's very expansive, and actually over time, since 1989, it has actually moved with the times. It's very facile. So in other words, it started out with Loretta Ford in 1965. I know you read that article I wrote for National Nurse Practitioner Week, but she saw a need for treating people who didn't have access to health care. And she just did an incredible job starting that program in Colorado, because not just in the city, but out in the country. And what happened was public health care nurses were meeting those needs and taking care of those people, but she felt they needed more training. So starting with that, the profession grew. And it has grown, and the educational components have grown also. For instance, as we know, our country is aging. There's also now educationally at the graduate level more emphasis on aging population and gerontology. Not just pharmacology issues or physical health issues, but psychosocial issues, et cetera. So it's really moved with the times. Wow. So when you go into graduate school, typically you're an RN with an undergraduate degree. Now you either have to have a master's degree or a doctoral degree in order to sit for your national certification boards, and then apply for your state licensure.
Wow.
So incorporating in that is a clinical component of education. There's pharmacology, there's business models if you want to think about independent practice, setting up your own businesses. There's psychosocial things, counseling, nutrition, orthopedics, respiratory, cardiac, you just name any kind of system that you're worried about. Dermatology, for instance, is another one that's very common that we see, and that's what we study. And so we come out fully prepared to handle the issues that we see every day in primary care.
Wow.
Which is really soup to nuts, kind of.
Well, that's very expansive. So given the shortage of primary care physicians in Vermont, and actually throughout the country,
right?
What do you think is the role of a nurse practitioner in today's healthcare system?
Oh, I think it's huge. For one thing, like I said, we're the 125,000 nurse practitioners practicing now, and we're sort of moving into different arenas of where there is need. 55 million people are actually not close to healthcare services. They're out of range of healthcare services, or else they're not receiving healthcare services, or their insurance will be threatened, and they're sort of out on a limb. So our job is going to be to meet those needs, despite physician shortage, is to go out and be prepared to take care of people in those settings, whether it's going to be in home care, community places like Grace Cottage Hospital, et cetera. So the nurse practitioner can, assess their condition, do an accurate history, review everything about their problems, and then figure out what you want to call their problem. You can diagnose it. You order specific tests sometimes, lab tests, x-rays, for which we're responsible, and then we determine a course of action. So we're prepared to take so many different problems that come in the door.
So nurse practitioners can practice independently.
Yeah, well, it's funny that word independently. I always think, what is that old expression, no man is an island? I think that no one really practices independently as an individual, but legally you can practice independently. And what that really means is, what is your scope of practice? In other words, can you practice to the level that you've been trained to do? So in Vermont, we have independent practice, which of course took years to achieve. And I know that there are at least 22 other states in the country that do have independent practice, which means we can practice according to what our educational background and clinical experience prepared us for. And the move is there, and that's one of the great ways of helping deliver health care to people that are out of service, those 55 million people.
Sure.
We always hear that term, 23 million people, we're coming into the healthcare through Obamacare, who is going to service them, but it's really, the problem is much greater than that 23 million who didn't have insurance.
Absolutely. So a nurse practitioner can do things like annual checkups.
Yeah.
And
come on down. When
now,
you have any problems?
Are they covered by insurance?
Yes, that's true. You have to certainly apply for the insurance companies. And back to the sort of, can we do annual physicals? There's all kinds of physical exams that we do. In fact, sports physicals, preoperative physicals. If you're going to take off someone's skin lesion, you need to do a good examination, look at all their medicines. And so you can't see a person without doing somewhat of a physical exam.
Right.
And it can become more expansive depending on what the need is.
So when you were saying before that, no man is an island and you don't practice independently, what happens if if you detect a problem and a specialist is needed? Do you make a referral? What happens?
I think probably the biggest thing is recognizing what you can and can't do, what you've been trained to do, and what you would like to refer on. For instance, there are definitely some things that are completely out of your league. I can detect a gallbladder attack and gallbladder inflammation and acute pain, but I know I can't take the gallbladder out, so that's an obvious referral. Right. But if you think about it, over the years, because of extra training, having gone to meetings that incorporated skills workshops, I was able to learn a lot about dermatology. So if you came in and you had a lesion that was suspicious, I'm trained to take that lesion out. So that comes with some time and extra experience, and also what your level of interest is. So I think that everything's interesting, so I like to check things out. And
Great.
So, for instance, sports medicine, I was kind of gifted by working at Mount Snow, and in those, starting with Mickey Wolf back in the probably 1980, and he saw 1,200 orthopedic emergencies a year Mount Snow. So I have a great fondness for orthopedics. So I feel comfortable doing a lot of that before referring off. So it's a lot of what happens is not just training, by going to these national conferences or local conferences, but working with people over the years and learning different tips that they've told you how to do or how to manage things, etc.
Wow. So
Because let me just go back to one thing, and some of that is self-directed too, and I think many people do this. For instance, when I first got out of school in 1990, I realized that people deserve better eye exams than I was comfortable doing, and in those days, like diabetics who have complications, diabetic retinopathy with disease of the retina, and so Dr. McGinn graciously let me follow him around and for a couple of days in order to really show me what proliferative diabetic retinopathy would look like, or hemorrhagic conditions that could be related to uncontrolled hypertension. So that was really a gift. So working with people, discussing things, it goes on sometimes daily, sometimes it'll be weekly, sometimes it'll seem like it's minute to minute, but I think everybody's in the same boat, especially as medicine changes.
So let me ask you this: if and I'm going to try, we only have one show to answer this question. Are there any differences in the care provided by a nurse practitioner than the care provided by a physician?
Let's see. I know the answer to that, and I hate it when we jockey one group of providers after against the other, because sometimes I think that kind of question is baiting. But what I will say is there have been multiple studies on the results of caring for people with certain conditions, comparing physicians with nurse practitioners. And let's just say one that comes to mind was diabetes or hypertension. And because we have standards of care we should look towards and medications that are more current to be used, you should be following those guidelines. So if each group is following those guidelines, the outcomes are similar, okay? And in terms of patient satisfaction, it's extremely high with nurse practitioners. So in terms of the public sort of wondering about that question, it's kind of for me, it's an older topic. I remember answering that question years and years ago. In fact, when I first started going to nurse practitioner school, my father, who had multiple chronic conditions, said to me, why would anybody want to go to a nurse practitioner when they could go to a doctor? And at about several years after I graduated, and he was towards the end of his life, he said to me, why would anybody want to go to a doctor
instead of a nurse?
He said, I love my nurse practitioners.
There you go. So let me ask you about that.
So I think it's just experience, knowing your person, trusting your person. And this is about communication, which is the beauty of family practice, primary care. It's developing that relationship and working with it as time goes on. In fact, I could even say that one of the essential person behind the camera here, I've known for, how old is Rolly now?
we don't say ages over the phone, over the air.
Okay, yeah. I've known him since he was this big, and he's just been a talk about over time, and see people over time on the streets, behind the camera. It's always a wonderful surprise. So that kind of like involvement in family systems and individuals goes a long way, really does.
So something that you said, though, nurse practitioners are often referred to as nurses.
Right.
But is that accurate?
We are nurses.
Nurses?
We've just sort of like, it's the core development. Probably every car is the same, but you put on different fenders and a different top or different tires. It's still a car, right?
Okay.
And so, we are, with nurses, we have the same core skills. We have interest in humans, we have interest in science, we have interest in systems and social issues, the finances of medicine, all of those. And what has happened through extra training is we built upon that base. In fact, that's what gives us our gift as nurse practitioners, is that we have this incredibly rich foundation as nurses.
So, but But nurse practitioners are specialized.
Some of them are. We all start. It depends on your definition of specialization.
Well,
okay.
How do you define it?
Well, for me, I actually think that family practice is specialized because it's so complex, day in and day out. It's sort of like there was this old adage. It's like you see womb to tomb and acute to chronic, whatever walks in the door, and that takes a huge fund of knowledge to be able to do that. Like I said, whether it's dermatology or orthopedics or whatever, it's not just this sort of superficial level of knowledge. It becomes deeper and deeper and deeper and bigger. It's exponential as time goes on. It's very rewarding. And so I think that for nurse practitioners, we are gifted because we started at that base and built upon it. Both in terms of our clinical practice as RNs and also as from our graduate education and our experience in clinics as we went through graduate school.
Now, you've written about the history and the evolution of nurse practitioners.
Right.
It was really interesting when you look at how it started and where it is now, and that whole evolution. A lot of it's occurred in your tenure.
Yes. Although Loretta Ford still has another 25 years or so, 20 years from when she started. That's for sure.
But
yeah.
How looking at that, how has it evolved? How do you see it?
I have to say that the evolution has been different depending on what your setting has been. I've been really gifted to work in rural healthcare medicine in places like Grace Cottage because we have just such a wealth of people that work there that are generous in spirit and knowledge. And, every night when one of our people come through, Chris, to sort of check on our office, make sure everything's okay. She works for housekeeping. It's just great to talk to her. We couldn't run this place without her. So it's not just always the providers that are getting the kudos for doing all the work. It's the nutritional department. It's occupational therapy. It's psychology. We have a community health team that is extremely, extremely rich in services. Their counseling department is really strong, and so we just have so many. And we have you had Deb Brown and Caroline Chase here. They're two members. Deb Brown is doing certified diabetes education, so she can expand on the knowledge I provide with someone in the clinic that needs more help than I can give them. So in terms of working in that setting, every single person that works in there is contributing to a person getting better. And I appreciate that so much. And, the wealth of nurse practitioners that are also working there and physician's assistants and doctors, et cetera, is just tremendous. It's really amazing. These people are so smart and so dedicated. I've been extremely lucky to work there. So in our setting, the role of the nurse practitioner is quite expansive. Like I said, it's sort of like what comes in the door you kind of own. And I remember in graduate school doing my internship at Brigham and Women in internal medicine, and someone sprained their ankle coming in the door. Well, I had, as an LPN and RN, also worked at the Mount Snow Clinic for years. I could have taken care of an ankle sprain in good, efficient time with a good outcome, and yet it's so specialized that person had to go down the hall to orthopedics.
Right.
So in other words, the role there can be somewhat limited depending on the resources. So, but you won't find that out here. Sort of everybody that we have at Grace Cottage is, pulling their weight and taking care of so many different things.
Now you're not the. Are you the only nurse practitioner at Grace Cottage?
Oh, no. You've met Jorda, of course. And then we have our newest nurse practitioner is Andrew Semigren, and he's working up in the hospital in the emergency department. And they're training him to be a hospitalist, which is quite rewarding and exciting for him. And Ben Wright, he is a psychiatric nurse practitioner. And so who else we have? We have, of course, Jordan. We have Devin Lucier, who has a great interest in gerontology, as well as she's an adult nurse practitioner. And so there are 5 of us.
Wow.
And it's great. And then we have physician's assistants that work with us too. There's Warren Montgomery, who has probably been doing this longer than I have, and he's in the emergency department. We have Danny Ballantyne, who is coming back to the clinic. He's been in the emergency department. And who else do we have? Oh, Natalie Harding. She's great. She just came to our clinic from the other side of the hospital, so
right.
We're quite lucky. We're so fortunate to have so much talent.
Wow.
And people we can bounce out, so
Right.
so that I don't feel like I'm practicing independently.
Right. Well, and it sounds like it's really a whole team approach. I mean, you're able to, a patient comes in,
Right.
They're not just seeing you; they're seeing the team.
Right. Well, yes. So, in other words, I'm comfortable saying I'm not in tomorrow, but I'd like you to have another checkup on, say, your fluid retention or whatever, and your respiratory rate and your heart symptoms, whatever. Then I can say, I'd like you to see this person. And you can depend on great care from anyone there.
Now, by the way, I just wanted to go back. So, do you still ski? Were you skiing when you went to Mount Snow?
Oh, yes, of course. Actually, I was on the ski patrol there.
Oh.
And I'd come back from being a ski bum with a degree in English, and I said, oh, I need to go grow up. I need to go back to my homeland. And so I was sort of still ski bumming, I guess, on ski patrol. And Dr. Wolf saw me dragging in a huge person and said, you want a job where you ski in the morning and work in the afternoon? And I was like, yes, he's going to hire me as a secretary,
right?
Because I have a degree in English,
right?
And he said, go to nursing school. I was like, what? He said, yeah. He said, you'd be great.
Wow.
Yeah, and so that he planted sort of that seed. So I sort of staggered my way up, going from LPN right here at Thompson School, and then in Bennington at Southern Vermont College for my RN, and then into Boston.
Wow, that is great.
I know.
That's a wonderful story.
Oh yeah, and I worked with Mickey and his wife for years. She was an RN, and that was when you used to dip your X-rays,
Oh my goodness.
Yeah.
But going back on the ski side, do you think has that changed in terms of ski patrol, and do they still have nurses doing that? And
oh, you mean at the clinic there?
Yeah.
The clinic is actually now the clinic has it's not. It used to have 24-hour coverage really,
right.
From November to April to the last day of skiing,
right.
Opening to closing.
Right.
The schedule is a little bit less limited,
right.
And they have coverage on weekends by physicians. They have some PAs there. It's run by Bennington Hospital.
Oh.
So, and they have some nurses there too.
But in terms of skiers, in terms of accidents or things like that, Grace Cottage has this 24/7 emergency.
Oh yeah, it's
care.
a great place to go.
So
yeah, in fact, Kimona Allen, who she is incredibly knowledgeable in orthopedics. She runs the emergency department, and so she loves it. Everybody loves ortho. You just can't be afraid of it. And what's interesting is that I think that's one of the places in graduate education, at least for nurse practitioners, where they could actually expand some of that, because it's such a prevalent thing in healthcare, especially rural healthcare.
Well, Louise, thank you so much for being on the show.
Oh, it's great to be here, and I want to just thank. I thank my patients. They've been incredibly rich in giving me the opportunity to be in their lives and trust me, and to help the whole profession of nurse practitioners. And thank you for, bringing this cause more forward as we kind of go into a time of sort of medical confusion.
But it's thanks to providers like you that really, you're the front line, and that's what's really wonderful. I want to do a shout out to the aforementioned Roland Boyden.
Yay, Roland!
For doing all the magic behind the camera. Thanks also to BCTV for helping us bring the show to you. If you have any questions, ideas, concerns, even if you want a future topic, you can send them to info@gracecottage.org. info@gracecottage.org. I'm Marty Cohn. Thanks for watching.